and experienced infection prevention and control staff from the Department of Health. The pilot who brought the ship in was in full PPE, which was checked and confirmed by WA Health. There are now 8 crew of the 14 who are reporting illness. Those 8 symptomatic crew members were taken off the ship temporarily, all wearing masks, gloves and observing safe distancing. They were taken into a purpose-made swabbing station for a COVID-19 swab. The swabbing was conducted by experienced Pathwest staff in full PPE, and the process was continuously monitored by infection prevention and control staff. The crew then returned to the ship to continue to isolate in their cabins. We expect their results to come through later this afternoon. Should any of the results be positive for COVID-19, the remaining 6 crew members on board the ship will also be tested. Every precaution is being taken to ensure the safety of port workers and the West Australian community. No health staff boarded the ship. Land-based port workers wore the required PPE, including gloves and masks, and followed all approved processes. Our authorities are working closely with the captain, shipping agent, vessel owner and the Commonwealth agencies to manage the ship and the crew. I have repeatedly requested and have been repeatedly assured by WA Health officials that every precaution has been taken and every protocol has been followed. It's essential we don't allow our hard work to be undone. Can I pass on our best wishes and support to the people of New South Wales and Victoria, who are currently battling outbreaks of the Delta variant of COVID-19. We had to deal with the same thing a month ago when it spread from Sydney to Perth, and we locked down quickly and crushed it. So our advice to our friends in New South Wales and Victoria is to hang in there, follow the rules, do the right thing, and you can kill the Delta variant. It can be defeated. I'll now hand over to the Health Minister, who will explain the support we are currently providing to the people of New South Wales.
Thank you, Premier. Thank you, everyone. Just very quickly or briefly today, just provide an update on the help our contact tracing team has given to New South Wales. Our team is often asked to assist with major outbreaks in other states. As always, they swing immediately into action. Their current assistance began on Saturday and is still continuing. So over the weekend, we did contact tracing for 31 cases. The cases were very complex with large families. Some 18 of these cases required the assistance of an interpreter. We had 17 staff dedicated to New South Wales contact tracing on Saturday, assisting with 20 cases. And on Sunday, further 16 staff helped with a further 11 cases. The New South Wales situation is obviously of extreme concern and still evolving. So I'd expect our team to be helping out for as long as is required. We know from past experience just how efficient our contact tracing team is and how they are able to react quickly when necessary. So I want to acknowledge the great work that they have been doing in Western Australia and now for New South Wales. And obviously, as the Premier has detailed, we've made assistance available to both New South Wales and Victoria, and we stand ready to help them out. I'll just hand you back to the Premier for questions.
Thank you, Minister. Any questions?
Premier, what's the protocol for if any of these crew members come back with positive results?
So we've dealt with this situation a number of times before. Ordinarily, if a crew member is positive and can be managed on board the ship, where they have a separate cabin, separate bathroom, well, that's where they would remain. If they're so unwell as to need to go to hospital or some other form of care, well, then they'd be taken off the ship. And that's what would happen. So that's the ordinary protocol. Bear in mind with these situations that obviously sometimes changes, just dependent upon circumstances. But if they can be managed on board the ship, they'll be managed on board the ship.
So we're not looking at this stage to bring in a substitution crew?
Well, it's too early to say, and not at this point, but we'll just continue to monitor the situation as it currently stands. Obviously, if the crew can remain on board the ship, They can quarantine there. It reduces the risk to all of us. If you take the crew off the ship and then transport them around the place and take them to hospitals and airports and the like, it actually increases the risk. So if we can actually keep the people on board the ship, they can quarantine there, recover there, that's probably the best outcome.
Is the person in hospital the crew member from the last ship?
Yes. So that's the crew member from the Emerald Indar who came into Geraldton. He's very unwell. And so I understand he's currently in a stable condition. His situation may have improved on what it was.
Some of the pictures that we've seen of some of the port workers who are escorting the crew off appear that they're quite close. You know, they're not keeping that 1.5 metre distance. Is that a problem, given you're saying that they're wearing masks and gloves?
Look, I saw the photographs. They obviously have to manage the ship in accordance with whatever rules they adhere to down there, but I've been advised they're all wearing the appropriate masks, gloves and PPE. So the advice I have is all the appropriate processes have been followed.
Indonesia is obviously struggling with a massive outbreak at the moment, and a lot of these crew members come from that country. Are you concerned we'll see more and more of these instances?
Well, we are, and obviously it's very sad for Indonesia. Like many West Australians, I've been to Indonesia many times, to Bali, so clearly Indonesia is going through a very difficult and terrible time. I expect the reporting of the number of cases and the number of deaths is seriously underreported, or the number of people dying is actually far higher than what is being reported in Indonesia at the moment. So it's a terrible time for Indonesia, but obviously with many of the crew or many of the ships coming via Indonesia, more than crew, it is a risk to us. So we'll continue to monitor. As you know, we've dealt with these situations now on probably 8 to 10 times, and we'll continue to deal with it based upon the strictest and strongest rules we can put in place. The crew members on this ship weren't actually Indonesian. They were Filipino, Russian and Ukrainian, and it may have been a Bulgarian, but they weren't Indonesian. But the ship did go to a number of ports in Indonesia where we think the crew members acquired the virus.
Do you think this is one of the more complex cases you've had to deal with in terms of ships, just because of the number of people displaying symptoms so far?
Well, they're all pretty difficult. You might recall there was one up in Headland where we had to take the whole crew off and fence off an entire hotel to put the crew members in there. I can't remember the ship's name now, but it was a difficult situation. Each and every one of them is difficult. What is more difficult, though, you're correct, Eliza, about this one, is the fact that this crew appears to be so heavily infected, although we'll get the results this afternoon, but it appears to be so heavily infected, and that makes it more difficult. As I said yesterday, if we'd enforced the ship, or tried to enforce the ship to sail with a crew that is entirely infected and the crew couldn't operate the ship, well then that's an emergency at sea, and that could have had all sorts of catastrophic consequences for us as well as the people on board. So therefore, we've had to take the measure we've taken.
So you're preparing for at least one of these to be infected with COVID-19, one of these crew members?
Well, there's currently 8 who are presenting with symptoms. So we'll find out this afternoon if they're positive, but we expect they will be.
There's a new case in South Australia, locally acquired case. Will that prompt any changes to the border?
Yeah, I've just learned about that. We'll be monitoring that. Obviously, we'll look very closely at South Australia over coming days. It doesn't necessitate us change the rules at this point in time, but if we have to, obviously we will. We've been I suppose you'd have to say, of all the states of Australia, we've been the toughest on all these sorts of things to try and keep the virus out, and our measures have largely worked. Not always, but largely. And we're seeing what's happening in New South Wales and Victoria as we speak, and we certainly don't want any of that to come here.
As I know it wouldn't be a press conference without something on the AFL, but in this case, where there is so much COVID and so many states are locked out from Western Australia, is there any talk with the AFL going on now? Quite seriously, I mean, they're in a dire. They look like they're going to be in dire straits.
Talk about what, Jeff?
Oh, anything, grand finals, continuation of the season over here.
Yeah, look, just about the grand final, obviously Victoria's going through a terrible time, so I don't think it's time to talk about grabbing the grand final from them. That's probably something that's a discussion for another day. In relation to the AFL, we talk to them every day to make sure that the whole system and the way it works, indeed all sporting events, is conducted in a COVID-safe way. We've basically got the protocols in place we had last year to ensure that sporting competitions can go ahead in a very safe manner. So that's the measures that are in place this year as well.
Have there been any discussions about a hub in WA, moving the whole competition?
Not as far as I'm aware. No, not at this point in time, but there's obviously teams that are here, and they're managed inside a bubble, and there's strong testing regimes put in place. All those sorts of measures are in place, which is exactly the same as we did last year.
The Nurses Union is calling for the crowd at the West Coast game to be scrapped or reduced. Are you considering that?
Well, they called for that yesterday, and obviously we don't have any COVID in the community in Western Australia. We have very, very, very strong border arrangements in place with New South Wales and Victoria. We don't see the need to do that at this point in time. Obviously, if we ever had cases detected in Western Australia, well, then we take tough measures in that circumstance.
1 million doses of Pfizer apparently have just arrived in Australia. I mean, I think our share of that would be about 100,000. Do you have any idea when they would be arriving here and where they would be going? Just metro, or would country be included in that?
We expect extra supply to come in next week. It'll be shared city and regional, and we want to make sure we get it into people's arms as quickly as we can. So we'll open up additional spots in due course, and an additional additional vaccination clinic in the CBD. But both regional clinics, city clinics, we'll get additional supplies when we get it. So what we don't do is open up additional slots until we're absolutely certain we're getting it. So I don't want to open up slots and then have to cancel people. So when we know we're getting it, we're absolutely assured, well then we can provide the additional appointments.
Would that include the pharmacy networks, because they've already started in the country, in the regional areas? Would they be going through there?
Well, they're run by the Commonwealth. So if the Commonwealth wants to provide additional supply to them, they can and they should. I actually think pharmacies are the key in many ways to getting more people vaccinated, because so many people go to pharmacists, they trust their pharmacist, and getting more people vaccinated by that method, I think, is a large part of what we need to do as a state and a nation.
What's the delay in getting the Pfizer here to WA? My understanding is that the 1 million doses have landed on the East Coast already.
I don't know. I assume it's refrigeration requirements and that sort of thing, but I don't know the exact details. I'm sure we'll get it as soon as we possibly can.
And are you confident that we'll be able to deliver 100,000 doses from next week as soon as it arrives?
No, what we do is we increase the rate of dosage per week when we get the supply in, and we've got to have enough to make sure that we get second doses into people's arms as well. So it's a lifting. I expect to have more to say later this week about the exact details of that, but it's a lifting in the weekly provision of the vaccine. What we also have to do is make more slots available, provide more staff, make sure that we have the capacity to deliver it. The whole system obviously is under pressure because I don't know if you've been, I'm sure you have been to one of our clinics, but it's a very staff intensive process, and we have to get those people out there and involved in the clinics. So that's our part of the deal. The Commonwealth does the other part, which is the sort of aged care and the GPs and the pharmacies. And I do think, as I said, there's 500 or 600 pharmacies across Western Australia. You imagine if each one of them could provide vaccines, well then it would certainly increase the take-up of the vaccines across the state.
On the issue of South Australia, they're not going to have a lockdown. They're going to announce restrictions. So will the borders be changing very soon?
With South Australia, we're just going to monitor South Australia, and we'll make a decision in due course.
Did the Perth Theatre Trust's ban on the Australian Christian Lobby go too far, or should the revised policy on that matter exclude groups like that from state-owned venues?
Look, as I understand it, the Perth Theatre Trust has reviewed the policy. They've changed the position on the ACL. That's a decision that they've made. They have a policy which is designed to avoid groups that might promote hatred or racism or any of those sorts of things. We have no involvement with that. I had no knowledge of it until I read about it online. It's one of those things that the Perth Theatre Trust will implement. I expect that the new policy will come out in due course, and the matter will be resolved.
Can you shed any more light on the CBD vaccination hub? Will it be at the exhibition centre, and when do you think it will open?
Well, we expect so, but we haven't resolved it. I expect we'll have more to say later this week, perhaps early next week.
We're still-
Sorry, go on.
We're still hearing a lot of confusion around the G2G pass. Given we've had that system in place for a while, is there anything that can be done to make it clearer and easier to use?
What's the confusion?
We've had lots of people. There was a case this morning of a family who, I think the husband and wife, there's a kidney transplant involved, and their children were coming across to be support carers. They had their G2G pass rejected, got police advice, and all of a sudden, I think because they've gone to media, it's been approved. But you know, we're hearing lots of reports. One police officer will say, reapply, you'll be eligible on compassionate grounds, and they apply, and that's not the case. We've heard sort of stories all week.
It's not a single person. It's not like the system is a single person making every single decision, so it's all exactly consistent on every single occasion. There's circumstances that need to be taken into account, and sometimes some of the decisions might seem quite arbitrary or harsh, but on the other hand, we have massive spread of the virus in Sydney and New South Wales, and we've got to prevent it coming to Western Australia. So I know our police who are implementing the system are doing it in the very best way they can. What we've done is cancelled thousands of G2G passes that were approved out of New South Wales and Victoria, and anyone who wants to come in then has to apply and go through the exemption process. So that's why it's tightened up significantly. Look, there's lots of times when it seems harsh and unfair, and police will try to take account of that, but what we're trying to do is prevent what is occurring, or what has occurred before in this state, whereby the virus has been imported from New South Wales to here.
Premier, the young man who drove a vehicle that hit a policeman the other night got bail today, and I understand the one who punched a policeman in the nose, I think he might also have got bail. Police department, the police union has called for reinforcements. They want immediate reinforcements to back up what's going on the streets in Northbridge. Are you listening to that?
Yes, we're putting an additional 100 police officers into the CBD and Northbridge, a massive increase in police numbers. That's part of our 950 additional police officers we're recruiting for the entirety of Western Australia, but that will make a huge difference. Obviously, I was briefed on these matters yesterday by the Police Commissioner, both in particular the car incident. That was appalling, absolutely shocking, and I'm surprised he got bail, to be honest, but it's a terrible thing for a person to do, and people need to think before they act, because the actions you might take in a split second can have a tragic consequence.
So those 100 police, are they, I mean, the police departments, the police union, I'm sorry, is saying they want them in like now, tomorrow. Is that what you're going to do with those 100?
30 have already been provided, and an additional 70 are being provided next month. So this is part of our overall recruitment campaign, by which we are getting more police officers into the system. The biggest recruitment campaign in West Australian history.
In your opening remarks, you spoke about the importance of sticking with lockdowns to eradicate the virus. Are you worried that they might not have the willpower for that in New South Wales if we keep seeing cases, a certain number of cases into the future?
Look, I've seen some of the images online, in particular of in Sydney, big crowds of people sort of wandering around without masks and celebrating and partying and going to outdoor gyms and all that sort of stuff. It seems bizarre to me. I would have thought that with what's going on, it's not too much to ask for people to follow the rules. And if the rules allow for people to go and do that, well, then the rules should be changed. What we experienced here was people just did the right thing, and we crushed and killed it. I hear there's some speculation out there as well that, you know, Delta can't be dealt with in that way. Well, we did. We dealt with it. We crushed it. Came from Bondi and Sydney to here, and we dealt with it over the course of 2 weeks, and we got rid of it. So I just urge New South Wales to make sure they do everything they can, because it's in the national interest. I mean, all of the bailouts for New South Wales, obviously people from here and other states have to pay for it. All of the cases in New South Wales get increase the risk for all of us. So just urge everyone out there who thinks walking along and, you know, having fun on the foreshore in Bondi or wherever it is a sensible thing to do. It's not. They should just follow the rules.
So WA dealt with Delta then?
We did.
Regarding
It was a couple of weeks ago.
yeah, regarding the ship's crew who've been taken off the ship, how if there is a negative case, or sorry, a positive case, apologies, how long can the ship be expected to be docked in Fremantle?
Well, it all depends on circumstances, but we can't. If the ship's crew is unable to sail the ship, it will be docked there until such time as it's able to sail. And what we expect to have happen is the crew members who are infected to stay in their cabins and isolate and recover. That would be the expectation. If it turns out the entire crew is COVID positive, well, then we'll have to deal with that situation. And that will be very difficult because managing 14 sick people and no one to actually operate the systems on board the ship will not be easy. So they're all the considerations we're currently going through. Clearly, most ships, we get them to sail away. But in this case, the number of infected crew members meant it was very difficult to get the ship to sail because the ship could actually become inoperable off the coast of Western Australia. Imagine what the consequence that could mean. That could mean the ship basically comes aground on our coastline. Crew members could die, massive pollution, whatever it might be. So that's why we're dealing with this ship as best we can in the circumstances we face.
There's something like 17,000 people on the housing list. You've got 1,000 or more homes that are empty. You're selling off houses at a record rate. I know you're talking about spending $1 billion on public housing, but when are you actually going to make a dent in it?
Well, there's a huge investment program in housing going on across the state as we speak, one of the biggest in history. And we ensured that there was a massive investment both in public housing but also in getting people to build private houses. That will make a difference over time. But what happened with a lot of the public housing stock was basically unfit for use. And so we had tower blocks in Victoria Park, Brownlee Towers, we basically had to knock down. There was some in Highgate, Sterling Street flats, we basically had to get rid of. And there's a bunch of them out there that were uninhabitable and we had to basically deal with. And it had been a legacy problem that had been in place for years that no government had ever actually dealt with this. So we dealt with it. That's meant a reduction in public housing stock, but we're investing $1 billion in new housing stock, and we've got the biggest investment boom in private housing, I think, ever in Western Australia, basically because of our home builder grants program. But the truth is, it takes time for them to roll out.
And is the shortage of tradesmen, is that impacting on you?
Well, I think it's impacting on a lot of industries. That's why we've reconvened the Skills Summit for later this month to work out what we can do to try and come up with innovative solutions to that problem, and making sure that we have properties being built is a high priority. But it's actually happening. There's a huge number of houses being built, but we didn't predict COVID. No one did. Returning Australians from overseas are obviously building houses and buying properties, and that's resulted in this massive investment boom and a massive purchasing of existing houses that is going on out there. But we put in place the home builder program, you might recall, in May last year because the whole industry was facing a catastrophic loss of confidence. And it's resulted in a massive building boom. So that's what's occurred. More houses will roll out, more properties will be available. That will actually result in more rental properties becoming available over time. And obviously we're building $1 billion worth of public housing as well.
Just on the ship, is there capacity for all 14 crew to self-isolate separately if they need to?
I'm advised they all have separate cabins. So hopefully the 6 crew members who are not symptomatic are not COVID positive. But the 8 who are unwell or showing symptoms, we're testing, we'll get exact results later on today. So they'll all have their own cabins to go to with their own bathrooms, get meals delivered and the like. But we're monitoring what can be done and how to manage a very difficult situation.
Very quickly, back on the issue of police recruitment, there are reports saying that Asian Australians, particularly multicultural communities, are reluctant to step forward to join the force. Do you believe that there's a bit of a problem there as well?
I'd encourage all Australians, if you want to be a police officer, apply to become a police officer of whatever background. And I've been to the police academy a number of times since I've been Premier. I've met people of all backgrounds who have become police officers and graduating from the academy, and it's a rewarding and fulfilling career.
Should the Queensland Premier have gone to Tokyo, and what sort of message does that send?
Look, if you're going to apply to get the Olympics, well then you've got to go full bore to get it. And the Prime Minister went overseas recently, a couple of times actually. I don't think it's inappropriate that the Queensland Premier go and do that. You might recall back in the days of when we were seeking the Sydney Olympics back in the 1990s, the then premiers did the same thing.
Do you have any plans to travel?
I'm going to Minganyu shortly.
Oh, I thought I'm sort of thinking a little bit further than Minganyu.
Yeah, and then I'm going to Meriden.
Fair enough.
And Kalgoorlie.
Have a good trip.
Hold on, where am I going? Minganyu, Morawa, Meriden, Kalgoorlie, going all over.
Wander out yonder.
That's it. Thank you very much.
Thank you.